Next, from Chicago, Governor Rauner holds a press conference alongside a task force he assembled to fight healthcare fraud at all levels of government. Governor Rauner and the task force report on their work and savings made. This runs about 20 minutes.
Every dollar that we can save in government operations, and cost to taxpayers is a dollar we can put into our schools. It's a dollar that we can put into services to help our most vulnerable families. And it's a dollar that we may not have to spend, so our small businesses don't have to bear unnecessary tax burden, and we can grow more good-paying jobs. Government effectiveness and efficiency, critically important. And this has been a core part of our administration from day one. We're very proud of the accomplishments we've made so far. As you know, we have made major strides in changing our IT systems in state government. We have been inefficient and wasteful in our IT. Many of our departments and agencies don't even have computer systems, and that drives up costs, that drives down productivity, and we're transforming that. We've already improved more than any other state in America on the way that we do IT and the digital services we've delivered. We have also helped streamline our government and found waste and inefficiency in virtually every department, and we're increasing productivity. It's very exciting. Healthcare is one of the biggest sources of spending, but ineffectiveness and waste. Unfortunately, in our healthcare system, we do have fraud, we have abuse, we have inappropriate payments. The federal government has estimated that roughly 6% of all spending in Medicaid is inappropriate. It's either wasted, or it's overpaid, or it's subject to fraud. 6%. That's on $548 billion at the federal total. Think about 6% on that. It's a lot of money. Here in Illinois, we spend $18 billion on Medicaid. 6% of that is almost $1 billion. Think about that. That's a lot of money we could put to help our most vulnerable, our autistic, our developmentally disabled, our veterans, homeless. Our vulnerable could use that money, and our schools. Too many of our low-income schools are underfunded. We could put this money to very good use. So finding waste in Medicaid and inappropriate payments, critically important. But health care is also very expensive, both for our state employees, our health care services for our state employees, very expensive. And there's a lot of inefficiency and waste there. And also in our workers' comp claims in government. Now, we've advocated workers' comp reforms for state government as well as for private business. Workers' comp costs are exceptionally high in Illinois, and that hurts taxpayers. That drives up the cost of government. So earlier this year, we formed a task force. Many of their members and leaders are here with us today. Task force to look at health care fraud in all levels. Medicaid, state health care for employees, as well as our workers' comp system. And we have already found extraordinary savings. I'm very excited. The task force put out his report. That's what we're here to summarize today. But to give you a few highlights, before our administration came into office, prior administrations were finding $90 million, $80 million, $94 million per year of overpayments or ineffectiveness. We found $220 million on the first shot through. $220 million of overpayments or savings opportunities. We also found $17 million of clear cases of fraud that we're able to go after and recoup. We've also found $22 million in savings in our state employee health spending last year. We found $32 million more in savings this year. Huge number. And the task force report said there's another $50 million in Medicaid that they've identified right now that we can go after and get very quickly. These are transformative numbers. This is money that now taxpayers aren't spending unnecessarily. This is money we can put in to help our families that deserve it and really need it, and also to put into our school system, because we've got to improve our school funding in this state. So this is an exciting time. At this point, I'd like to turn it the podium over to Maggie Hickey, our administration's Inspector General. She's the chair of our task force, and she can comment with some more detail. Maggie.
Thank you, Governor. Thank you very much, Governor. I'm Maggie Hickey. I'm the Executive Inspector General, and it's been an honor to serve as the chair of the Healthcare Fraud Elimination Task Force. I want to thank the task force members for their hard work, their expertise, and devoting their time to this important endeavor. Healthcare fraud, waste, and abuse is rampant in Illinois, and this task force is a great opportunity for the state to improve on its current efforts, ensure that taxpayer funds are used for not used for fraudulent and wasteful purposes. During our initial 6 months, the task force focused on understanding the current resources and systems used to address healthcare fraud and abuse and waste in Illinois, and developed a strategic plan to save taxpayers in the most efficient manner. We gathered information from our members, other state agencies, industry experts, and including the federal experts from the U.S. Attorney's Office and HHS, and also our managed care organization partners. We also looked at the current use of state resources to address waste, fraud, and abuse. The task force then divided itself into 3 working groups focused on Medicaid, workers' compensation, and the state employee group insurance. The task force then developed a focus for these working groups, and we focused on 4 areas: collaboration and coordination, data analytics and metrics, accountability and efficiency, and most important, safety and wellness. One key takeaway from our information gathering is that while addressing fraud after it occurs, commonly known as the pay and chase, is important, but big savings can be realized in fraud and waste prevention. Stop the fraud before the state pays the money out. The task force also recognized that improved data analytics and collaboration amongst agencies is a big part of Illinois moving forward with their fraud prevention efforts. During the task force's initial meetings, it became clear that information, resources, and efforts to address fraud, waste, and abuse in state-administered programs were, for the most part, isolated within the agencies, operating in silos. The task force facilitated regular meetings amongst the agencies that have similar programs or work with similar providers in order to more efficiently identify and address fraud, waste, and abuse. The task force also launched targeted initiatives for certain programs that were cross-agency, such as a managed care initiative and an in-home care initiative. The discussion today is about our first 6 months and what we learned. Going forward, we will continue to collaborate and implement the best practices to save Illinois taxpayer dollars while providing quality care. I now will look forward to hearing from other task force members, and I turn it over to Felicia Norwood, the Director of HFS and a fellow task force member.
Thank you, Maggie, and good afternoon. As the Governor mentioned, the Illinois Department of Healthcare and Family Services spends over $18 billion every year in its Medicaid program. We are the largest insurer in the state, insuring over 3.2 million individuals. That's 1 out of every 4 people in this state. We take healthcare fraud, waste, and abuse very seriously. As all of you know, just recently, last week, the state of Illinois submitted an 1115 waiver to the federal government. That waiver is going to allow us over a 5-year period to bring in an additional $2.7 billion into this state. We are trying to transform the way that we provide services in the state of Illinois, in the Medicaid program, focusing early on behavioral health. An important aspect of this is paying for value. In the Medicaid program, we have typically paid for volume. Fee-for-service has been the way that we've typically delivered services. We don't plan to do that going forward. We are migrating to a system that pays for value, quality, and outcomes. That will be a key component of our ongoing efforts to address the issues of waste, fraud, and abuse in this program. We believe that every dollar spent in the state Medicaid program should go to those individuals who need it most. And those are the individuals that are the most vulnerable in this state. This department is honored to be a part of this effort because we believe that the taxpayers and our Medicaid beneficiaries should expect us to make sure that valuable resources are going to the place where they're needed most, which is to those who are in the care of this state, in this department, for core healthcare services. Thank you very much. At this point, I want to turn it over to Brad Hart. Brad is the Inspector General for the Department of Healthcare and Family Services. He works in partnership with all of us in trying to make sure that we are maintaining the highest standards of program integrity within the Medicaid program. Brad?
Thank you, Director, Maggie, and Governor. Thank you. As the Inspector General over the Illinois Medicaid system, I'd like to add my wholehearted support to the Governor's task force and its objectives. The Medicaid Inspector General's office has been diligently working over the past 5 years to build a partnership with all entities that direct, regulate, and participate in the Illinois Medicaid system. OIG's efforts have led to increased use of best practice data analytics, increased education of providers and recipients, increased return on investment for the taxpayers of the state of Illinois. In the very near future, we will be putting out our fiscal year 2016 annual report, which will depict cost savings, recoupments, and cost avoidance in excess of $220 million. While we have made great strides to become a national leader in the realm of Medicaid program integrity, there's still much more that we can do. The task force report highlights some of those areas where all of the entities involved can work better together to achieve the greatest return for the taxpayers. Over the last 5 years, OIG has enhanced our audit processes, continued development and use of analytics to identify fraud, waste, and abuse, generated initiatives that recouped overpayments from many different provider types, enhanced our administrative sanctions of providers that commit fraud, waste, and abuse, enhanced our relationship with local, state, and federal law enforcement agencies, educated providers on the rules and regulations surrounding their submission of claims, implemented a very successful self-disclosure protocol, and further pursued our motto of accuracy, fairness, and transparency. In the future, OIG plans to pursue the recommendations of the task force by increasing the amount of data upon which we can perform analytics, continue to develop our best practices analytics system to help identify fraud, waste, and abuse, increase and refine our audit plans to make sure our audit processes are as efficient as they can be, increase our capabilities to pursue highly technical professional investigations, increase self-reporting of overpayments by providers, increase education of providers and recipients so that they do the right thing to begin with, and continue the development of initiatives to attack vulnerable areas of fraud, waste, and abuse within the Medicaid system. Therefore, I look forward to working with the task force membership to make sure that taxpayer dollars are efficiently spent to help those that need assistance and to pursue those that would abuse the system for their own benefit. I would turn it over now to HARDIK BHATT, who is the Secretary of the Department of Innovation and Technology.
Thank you, Brad. Thank you, Brad, and thank you, Governor. It's been a privilege for the last 18 months to be able to serve the 13 million Illinois residents here. And basically, you know, I'm not saying this because I work for this administration, I work for the governor, I work for 40 different cities, work with 40 different cities globally, Barcelona, Chicago, Hamburg, Dubai. And this is probably the right time, right leadership. This is the administration that really understands the power of technology to enable the government, to enable the customer service. And basically the governor proved that earlier this year when he brought all of the disparate technology resources across the state together to create, first time in the history of the state, the Department of Innovation and Technology. We all came together and now we are working for enabling our business. And we are trying extremely hard, working extremely hard to come through with the promise of transformation. As the governor mentioned, in the last 18 months when we started, Illinois was ranked in the bottom 4th of all of the 50 states in using technology and giving outcomes to our businesses and to our customer to provide better services. In the recent rankings that were released in September, this is a neutral ranking that comes from a Digital States Survey, Illinois was ranked in top 3rd of the 50 states. So from bottom 4th to top 3rd in 18 to 20 months, and we are continuing to move forward. We delivered, first time again in the history of the state, a unified financial management system, and we are moving towards adding more agencies to that. We have created a platform that can now allow us to roll out a mobile app every month. But I think the biggest breakthrough is just by having technology sitting at the business table, talking to the people who understand business, who need technology to enable them. We've been able to break through in one of the things that is very stereotypical about governments is we all feel like, you know, this is my system, this is my data, I cannot give that to you, even though that data actually belongs to the customer and we are all collecting that. We've got hundreds of systems that keeps this data in silo, and it doesn't make sense if you're only looking at that from that myopic view. So what we did, Indiana is considered to be one of the leading states in using data analytics, and it took them 18 months to create a data sharing agreement among all the agencies and technology. We did that, we learned from them, we give credit to them for that, and we did that in 7 months. 13 agencies came together. signed an enterprise data sharing agreement, and now we can go across all of these agency silos and system silos, share data, and see what's going on with our customers. How can we improve the customers, the service that we are providing to them? At the same time, how can we make sure that we can reduce the wastage that's going on in the taxpayer resources? I believe that as a technology executive in this administration, my premier job, because I'm getting paid by the taxpayer dollars, is to save every tax penny that I can. And I'm very fortunate and privileged to be working with the task force members to enable them to do their work. Again, thank you very much. It's a pleasure and privilege to work on this important initiative. And let me turn it over to Captain Brian Lee from the Illinois State Police. He leads Medicaid Fraud Control Unit for Illinois State Police.
Thank you, HARDIK. Good afternoon, and thank you, Governor, for allowing me the opportunity to speak today. Thank you for allowing me to represent the state police on this task force, and thank you for your commitment to eliminate fraud, waste, and abuse from healthcare programs throughout the state of Illinois. As the director of the Medicaid Fraud Control Unit, I bring the enforcement aspect to the task force. It's my responsibility to share with the other state agencies the fraudulent techniques and schemes of those dishonest medical providers involved in the Medicaid program. For example, I have shared some investigations of medical professionals who submit claims for medical procedures that never occurred. Medical transportation companies who submit claims for service for transporting individuals, and those individuals had passed away months before. And lastly, home care assistants who claim they are providing services for vulnerable individuals, but they don't show up to provide the much needed care, yet they turn in a timesheet and expect to be paid timely. Sharing this knowledge provides our experts the opportunity to fine-tune the systems within our control and to ensure it doesn't happen again, or at least make it much more difficult. The Executive Task Force is doing exactly what state agencies need to and should be doing, working collaboratively, sharing resources, and discussing ways in which we can become more efficient and more productive. Quite often we see task forces created and the result is simply pen on paper. I can attest, after numerous task force and working group meetings, emails shared amongst the members, and attending our 2 public meetings, this is an active task force, and I'm confident fraud, waste, and abuse of our healthcare systems can be significantly reduced as a result of our collaborative effort. The 6-month task force report recently published reflects 42 fraud convictions and nearly $17 million in recoveries from federal fiscal year 2015 as a result of our criminal and civil prosecutions. I'm pleased to report that for federal fiscal year 16, that number has grown to over $21 million in recoveries and 40 fraud convictions. State police investigators and intelligence analysts are passionate in thoroughly investigating allegations of fraud, neglect, and abuse of the Medicaid program. Again, Governor, thank you for this opportunity. And my final comment is more of a request for the citizens of the state of Illinois. At some point in our lives, we all receive some type of medical treatment. It's incumbent upon us all to review the claims and the payments for the services we and our families receive. Please take the time to review the medical statement for accuracy, whether you're paying them, the insurance company is paying them, or a government program is paying them. If we can stop the fraud, waste, and abuse together, the end result will be better, more efficient health care for you and for our loved ones. Thank you. Governor.
Thanks, Brian. And I want to say thank you. Thank you. We're very blessed in Illinois. We have wonderful public servants leading our departments. I'm very proud. I believe we have the best team ever assembled to help run a state government. I'm honored to be their employee. I work for the people of Illinois. We all have the privilege, the honor of doing that. FELICIA, Norwood, HARDIK, BHATT, and their fellow directors and leaders. Maggie, thank you. They're outstanding. Great public servants. And this initiative, critically important. I personally believe in the next few years we're going to save hundreds of millions of dollars more than the $270 million or so that we've already saved in our healthcare system, provide higher quality services, and get those dollars to the families and the individuals who need it the most, and get the money where it belongs, not into waste and abuse. And this is very exciting. This is a very critical initiative. With that,
you're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.